Malaria is a very rare but treatable infection that plagues certain areas of Brazil. Tourists are warned about this infection and often other countries demand a vaccination prior to travel. Malaria is a very intense infection that is transmitted by mosquitoes and spread by animals and insects. It has some very uncomfortable effects on the infected, and though in some cases is not fatal, can very well make that individual wish for death. Though malaria is diagnosed by a physician, a lot of Amazonians do not have quick access or the financial means to access physicians for diagnosis. The waters of Brazil are beyond unsanitary, and it only gets worse the further one gets from tourist areas. Symptoms of malaria include chills, fever, and extreme discomfort. Malaria can spread by blood, which is important to know since unclean medical equipment, drug needle sharing, or simply the care of someone with an exposed biohazard could easily be a carrier. People became more aware of the water conditions when the Olympics chose Brazil. No actions were taken to ensure the waters would be clean by the time the Olympics made its way to Brazil. This is a popular area that is unkept, so it is no surprise that the rural areas are much, much worse. You know what they say about feces and hills. Brazil is some ways away from the United States. However, Zika was not an issue the U.S. needed to be concerned with. Ebola was in Africa, so the U.S. was not concerned with it, and the West Nile virus was not the concern of the U.S. either, until it was. It goes without saying, it's usually the issue ignored because it's nowhere near the U.S. that usually finds its way to the U.S. doorstep. The policy that I am encouraging you to pass will affect all of those who travel, work with those who travel, and live with those who travel. This can be anyone from a high top executive to a teacher who travels in the summers. For instance, a teacher who travels can easily transmit the infection via a paper cut. Touch a child, you're infected, the paper cut extends over to the child's hand, the child places their hand in their mouth, and there's a 50-50 chance of transference. Every time someone travels, the virus and infections of the rural area need to be considered, like they're a common cold. So easily infections and viruses are carried into the U.S. via U.S. citizens who travel back and forth. The U.S. is focused on immigrants so strongly that it ignores its own traveling carriers. By choking the ability to ignore the highest percentage, infections and viruses of the areas travel from one to another. This policy will force everyone to take action and responsibility with regard to the movement of infections and viruses in and out of certain areas. Dallas, for instance, is a major airport and used often for international layovers for the central and western states. Airplanes are perfect vessels for spreading diseases, infections, and viruses. Though the costs of this policy are minimal compared to the over 2.2 million lost in the development gains in other countries, it will still be a significant haul at about $1.5 million. The concerns regarding enacting this policy is that the money will be needed by another country in an emergency capacity and that the United States will not have the funds at that point to give. But the risk of not enacting the policy is at a much greater cost. By enacting this policy, the U.S. is vulnerable to infectious diseases it does not typically face, and therefore the cost in lives will outweigh the monetary costs. If this policy is enacted, people who have already been infected will have access to not only modern medicinal resources, but also the Aboriginal people that have been proven to have complementary and alternative medicinal resources that have also been proven to work. Though they have not been confirmed by the FDA, they have been proven to work by those who are not associated with the FDA. Part of the policy is the idea that if 5 people agree with an idea, then a 6th person should most likely take the opposition. The reason the opposition is necessary is so that you can plan accordingly with the one thing that wasn't planned for initially by the other 5. This is something that was noted from a movie called World War Z. The reason this is a very intelligent way to look at medicinal issues, especially when it comes to infectious diseases and viruses, is because 9 times out of 10, most people agree with something that they are accustomed to, like Western medication or modern medicine. What people usually don't think about is the complementary and alternative resources that are available in areas such as the Amazonia that can help with modern day issues, big and small, from the common cold to cancer. When all modern medicine is exhausted, there's only another option, and that's holistic care. When there's no money to go to a modern doctor, when one lives entirely too far away from medical care, the Aboriginals see their shamans and medicine doctors. Their solutions have worked. However, modern medicine and the billion-dollar industry associated with it is not in a hurry to allow the research or the resources necessary to tap the Aboriginal regions for cures, solutions, and immunizations. If you think about it, if a person can be cured by herbs or other such holistic care for $25, it's a lot more difficult to charge them $25,000. Having foreign health workers being afforded the resources to facilitate research and control over travel to and from the U.S. internationally will greatly increase the knowledge of holistic remedies and equip the U.S. to battle what's trying to get in. Politicians are focused on money because money controls their candidacy. When the big money chokes the campaign, they stop fighting for whatever the big money wants them to ignore. Very often, healthcare industry is associated with this big money. Billions of dollars are spent to make sure the focus is where the all-influential want the focus to be. A quick glance at the ACA, the Affordable Care Act, shows that although the intention was great, the wealth spent a lot of money making sure that those close to the poverty line who truly needed it would not be able to access it. Without a loophole, anyway. Big money pushed for states to have an option regarding who is covered and who is not. Thus, over 3 million people were left without medical insurance. These 3 million people were also forced to pay a nominal fee for not having medical insurance. But this is information that the money doesn't want the public to be aware of. Thus, the legislature used a sleight of hand and to keep the U.S. focused on other things, which they're paying to make happen. Though your politicians have the best intentions, campaigns do cost money. While they demonize the things that can help with financial instability, it's unfortunate that campaigns are run by finances instead of run by the voters. This is the message that people are receiving, unfortunately. That their legislatures don't care, they're brainwashing them, they're making decisions based on bottom lines and not the desires of the voters. This policy proves otherwise. It not only proves that the U.S. government understands the needs of the voters, but it also takes into consideration that the legislature is listening to the voters. Today's society is focused on holistic healthcare, focused on fitness, focused on finding remedies to health concerns that in the past years always called for some type of chemical reaction in the body to find a cure. The legislature has done everything that they could so far within the parameters of the campaigns and the campaign money to ensure that the U.S. feels cared for. If we look at President Obama's wife, Michelle Obama, the entire presidency she spent focusing on fitness and health. Imagine you have an entire school or hospital full of U.S. citizens. One citizen has traveled to Africa. One citizen traveled to care for other people, came back with Ebola. The entire United States goes into an uproar. Now we have to get in touch with WHO and find out how we can address this issue. Though there are no known causes within the U.S. to bring this here, we did know that travels were what caused it. We knew that our physicians going overseas is the reason why we wound up in a position where we were in a frenzy to fix this issue. We don't have a holistic solution to Ebola. We also are not looking for a holistic solution to Ebola. We're not looking for a way to fix this issue that doesn't destroy ourselves or destroy our own self-healing process. It takes a lot of bad situations to make good situations come into play. It takes a lot of chemicals and chemical reactions to make people realize that whatever the solution is at hand is most likely not the solution that we were looking for. The body is built to heal itself. The policy that I am encouraging you to enact doesn't call for you to ignore modern medicine. It calls for you to supplement it.